Hi, I'm Amar Jory. I'm a cardiologist here in Kingston, Ontario at Queen's University. I'm very interested in looking at cardiovascular health in athletes. Specifically, our group is interested in preventing sudden cardiac death in athletes, as well as promoting safe exercise across communities. To this end, our group is holding a special conference here in Kingston, Ontario on October 5th. This conference is Canada's first sports cardiology conference with all virtual attendance, and we're hoping you may decide to join us.
I'm personally very excited to be part of an outstanding group of individuals, all of whom have different skills, different expertise, different interests, both research and clinical, all of which are directly or indirectly related to the health consequences of sport, whether it's endurance sport or elite sport or recreational sport, and the heart. I am a passionate believer in the power of networking and the power of bringing together people with different interests and expertise in one room at one time.
In my entire professional career, I've been privileged to have a very distinct and direct involvement with the care of elite athletes. I think it's very important to convene a meeting like this with experts from a variety of disciplines. And just in the initial few minutes of this meeting and the discussion that has unfolded, it's quite clear that there are an array of challenges in terms of addressing sudden cardiac death and cardiovascular health in general across populations who are physically active or exercising regularly, that merit consideration and thoughtful but forceful kind of approaches.
And the purpose of this event today was to bring together a group of experts from across Canada to discuss different safety initiatives and strategies to implement specifically for athletes and those involved in sport, whether it be kids, varsity athletes, elite athletes, or even just your weekend warriors or beer leaguers, just to make sure sort of everybody across the spectrum of sport and within communities are covered.
It's important for us to bring the experts from across the country because we need to drive system level change. We can't do this one at a time.
Networks are the way we get things done in Canada. Our geography is vast and we have remarkable expertise spread from coast to coast. And through a network model, like we're trying to build and consolidate today, that is how we will make the connections that we need across provinces and territories to really enable work. So we have excellent knowledge mobilization, relationships in place, and sharing of knowledge so we can accomplish our goals to reduce sudden cardiac death.
As I said to Dr. Jory, this is extremely important work, and it doesn't receive enough attention. So as Jordan's parents, we're really pleased and happy to see that somebody is taking on this cause to raise awareness of cardiovascular safety and protocol.
The most important component to any safety program is an emergency action plan. There's no question about it that having a plan to react to a serious event and knowing how to implement that plan is what really saves lives.
The most important thing in education of people and CPR everywhere, public arena, everywhere.
In order to make progress in medical science and care for our patients and our individuals that are not yet patients requires the simultaneous presence of individuals who can converse together and through brainstorming, networking, discussions, develop ideas, strategies, processes that will improve care not just for our immediate patients but for the wider community through outreach, education, knowledge translation.
Ensuring the cardiovascular safety of athletes probably is underpinned entirely by good information that is widely understood by everyone in the universe of that athlete's care and development. So athletes need awareness, their families need awareness, coaches and sport organizations need to be in this community, and this is where they will intersect with the scientists and the healthcare professionals who can help assess whether or not they're at risk, and then provide them with all the tools and information that they need to be prepared and avoid an accident or a very serious situation.
The general consensus that has been coming out of this meeting so far is that there's a lot of different players across the province that are sort of initiating safety goals that meet sort of one common mission. And really the purpose of this gathering was to sort of bring everybody together so we can come to an agreement and organize sort of a network that really focuses on super important pillars, for example, like exercise promotion, screening initiatives, and cardiovascular safety initiatives for all athletes involved in sport. Is that good?
I think probably the most important component of ensuring the safety of Canadian athletes from a cardiovascular standpoint is to sensitize those healthcare professionals who take care of them of their responsibilities to identify those who may be at risk, to assist in the education of athletes of all ages of the potential risks that may be associated with sport, and the importance of understanding and acting on symptoms.
It's amazing, and we're just a small part of the big picture. So when you see it from their perspective and how they're willing to help, it's amazing.
I'm very excited to be here. It is a terrific community of people who have a real passion for preventing sudden cardiac death among Canadians. It's a long-standing group that knows each other well and has worked together well for decades, and it's a real honor to be in the room with this whole community in one place on this day.